Hello, I'm Dr. Greg Force, Clinic Director here at the Pain and Brain Healing Center. And I'm a board-certified chiropractic neurologist, nationally certified in acupuncture, and certified in applied herbal sciences. I specialize in the natural functional medicine approach to health problems. Now, I'm also the author of the best-selling book on chronic pain, chronic myofascial pain, fibromyalgia, and chronic fatigue, Why We Hurt. It's a 400-page expo on all the underlying issues that are involved in chronic myofascial pain. This video is an explanation of what is chronic myofascial pain. Now, if you're suffering with chronic low back pain, chronic hip pain, shoulder pain, neck pain, and you keep getting drugs, you keep getting adjusted, you've been doing different things, and it's not going away, you have a chronic myofascial pain syndrome. And in our society today, we tend to want to take a very physical approach to these issues, which is helpful, but we're ignoring the underlying metabolic issues. So if you want to get rid of this chronic low back pain, constant physical therapy, rebuilding exercises, spinal adjustments, whatever, you're not going to get the relief you need until you look to the underlying metabolic issues. In other words, you have to have the courage to think outside the box. And that box is made up of your doctors or therapists' educational perspective and prejudice. And if they're not schooled in functional medicine and the underlying metabolic issues involved in chronic myofascial pain syndromes, don't know about myofascial trigger points or understand the metabolic aspects of chronic myofascial trigger points, you're not going to get much progress in your recovery. If they are a rheumatologist, they're going to look at some sort of anti-inflammatory drug that shuts down certain metabolic pathways. It could even suppress your immune system. You're going to be looking at a physical therapist who may keep stretching and strengthening. Again, not looking at the underlying metabolic issue that is hugely important. Then your insurance company, they have certain policies. Low back pain, so many days of manipulative therapy, so many days treatments of physical therapy, whatever, they're going to set what's called the standards of care. These two aspects, standards of care, and what they say is medically necessary. And you may be seeing that on your EOB, what is medically necessary. This wasn't medically necessary. I'm here to tell you that you need to do what's necessary for your health. You need to fight for your health. And today, if you have chronic myofascial pain, maybe some fatigue, and it might not be, you have this chronic low back pain, chronic neck pain, maybe chronic headaches with it, shoulder pain. It's a regional pain syndrome. You might also be on antidepressants. You may have some GERD, digestive issues. All these are signs that there's more underlying issues. So you need the courage to fight for your well-being. You need to be able to say, I fight. I invest in yourself. You need to invest time and resources in your recovery. The F stands for focus. You need to refocus your life, and the primary issue is food. Diet plays a major role, and one man's diet is another man's poison, or woman. We need to look at underlying issues as far as food allergies. Maybe you've heard about that, but food allergies can play a major role in the formation of inflammation and then your formation of trigger points. I stands for immune system tied into inflammation. Inflammation is huge. Now, if we use a pharmaceutical to knock out metabolic pathways, we end up with a lot of problems. So we can't just tackle the inflammation with heavy-duty drugs. There are other ways. And a lot of times we have to look for the underlying issues, and sometimes those are chronic infections. And one of the biggest reservoirs of chronic infections or bacterial imbalance is in the gut. The GI is central to this fight issue. GI tract is like the roots of a tree, and they have to be healthy. Just like the roots of a tree, to extract the nutrients you need. And if you have malabsorption, maldigestion, you may have deficiencies in certain nutrients, and that's why you keep reforming trigger points. Magnesium is huge. A lot of people know about magnesium, but they don't realize that they are malabsorbing, and they're not getting, no matter how much magnesium they take orally, they're not getting it in to their body, and we have to fix the GI tract first. H is for hormonal balance. Thyroid plays a role in chronic myofascial pain, and you need a very healthy thyroid axis or adrenal axis. There's things to look at there as far as adrenal balance. Female hormones can set women up for more myofascial pain syndromes. Headaches again. So we have to look at hormonal balance of female hormones. And then T, the underpinning bottom of it all, toxic chemicals and metals. And that's why we're here and somewhat in the mess we're in with 1 in 66 children with autism. Every 72 seconds, some old individuals getting Alzheimer's. I mean, we're seeing changes within our society. We have a problem with toxic chemicals and heavy metals in our environment that we all are picking up. It's not whether you're exposed, it's how well you are detoxifying them. So to really heal your chronic illness, pain, and fatigue, that chronic myofascial pain, you need to really fight back. And no matter if it's a fibromyalgia, or a chronic myofascial pain syndrome, a chronic low back, I know this is getting a little more in depth than you maybe want to do. You just want to do some exercise and be over with it, but that's not working for you, or you wouldn't be here. We need to look at laboratory tests to find out what's going on. You say, well, I had some lab tests. Well, they're usually very basic. Only minimal, non-specific tests are run. From a functional medicine standpoint, I need to run more specific tests to find out what's going on in the tissues. And these are normal levels, not optimum levels. So now we take a statistical average of individuals, take that aggregate in the middle, say that's normal, and that's maybe not always the case. We look at some things like fibrinogen, and it can be up in the normal high levels, and that's been shown to actually be an indication of chronic inflammation and actually hypercoagulation, thickening of the blood, which causes reduced blood flow to the tissues. So as a doctor of functional medicine, I'm looking at many different biomarkers in the blood, in the urine, looking at specific functional medicine tests to look at what is most optimal. So we don't look at just the laboratory normals. We look at trends, AST, ALT, liver enzymes. They may be trending out towards a high level. We want to start affecting change in the liver now before it becomes a NASH or some other liver disease disorder. Same things with things that are running too low. So without getting too much specifics, we need to look at laboratory testing in a more specific way, a functional way. So whether you have myofascial pain syndrome, chronic fatigue, whatever, there is a loss of cellular energy and vitality, and part of it's the mitochondrial function. Chronic myofascial pain syndromes, but you actually have to use energy to contract your muscles, and it actually takes more energy to relax your muscles. And inside of the muscles, you can form chronic myofascial trigger points, which is what's leading to the chronic muscle pain, the neck pain, the headaches, the low back pain, the hip pain. And a lot of that relates to mitochondrial dysfunction in the muscles. We'll get to that. So the key to myofascial pain syndromes is the energy and vitality produced by the muscle cell. This here is a representation, very basic and simplistic, of a muscle cell. So we have the membrane, we have the mitochondria, we have the nucleus. Now these little things called mitochondria produce energy. That's the energy that you use to move your muscle. They also use this energy to relax your muscle. The mitochondria take calories, blood glucose. When the insulin binds, we get that to come in, create ATP, we have plenty of energy. Now, if we don't have healthy mitochondria, where you have insulin resistance, we have low thyroid function, all these things need to be looked at for chronic myofascial pain. Let's say, well, why is it just in my back? What we find in chronic myofascial pain syndromes, low back, neck, shoulder complex, it's usually the shoulder girdle neck or the pelvic girdle low back. Now, those may be areas of past injury, and it's kind of the weakest link in the chain. In other words, if I had a chain here and I was pulling on it and there was a weak link, that would be the one that would break. And your body's like that chain, and if it's under metabolic stress and we start to pull on it, whatever link in your chain of your being is the weakest is going to break. It's going to show up. It's going to hurt. That could be a low back from an old low back injury, neck, shoulder from an old whiplash injury, whatever. So there is explanations why it keeps showing up in one area. So these muscle cells, and you can replay this video to get this, need to have a tremendous amount of energy. You produce your own weight in ATP every day. And if you have insulin resistance, which is so common today, and people go undiagnosed because all that's heavy run is a blood glucose. You need to have more than just a blood glucose level run. Triglycerides, hemoglobin A1C, a ratio of HDL to triglycerides. I need to look at different biomarkers to know and insulin levels. They're rarely ever run, only in diabetics, but I can see people have normal glucose, but their insulin is off the chart. they're struggling to keep their glucose normal. And having high insulin can create muscle pain and inflammation. So there's a lot to look at. However, the point is you need to have plenty of energy to keep your muscles healthy and not form trigger points. So, and also not have brain fog. If this is happening in a nerve cell in your brain and you're getting low ATP production, that takes a lot of energy to fire a neuron and release a neurotransmitter. And if that's not happening with serotonin, you may be depressed. With dopamine, you may lose focus. So brain fog is the same thing in mood dysregulation as muscle pain and fatigue, except the brain doesn't have pain receptors, so it's not going to say, ow, it's going to say, I'm lethargic. If this is making any sense to you, then you need to pursue this form of healing. So this is an example in myofascial pain syndromes. We're going to use the thyroid as an example of running the right test. Here's the pituitary. It stimulates the thyroid with TSH. That dumps T4. All it's ever measured medically is TSH, sometimes T4. This is only a prohormone. To help your muscles, it has to be transformed from T4 into T3, and a small portion becomes free, unprotein bound, enters the cell, stimulates the mitochondria. Out comes ATP. It stimulates the mitochondria to, it's like the gas pedal. You know, get going, produce ATP, don't be tired and fatigued, don't form trigger points. All this, now unless you're testing TSH, T4, free T3, you're not going to know if that's the underlying cause of your chronic back muscle pain, muscle aches, myofascial pain, why keep forming trigger points. And then there's something else. The body also produces a brake if it's got a gas pedal, and that's reverse T3, and you need to measure that to know if you've got too much brake on. And then again, you need to understand if you have insulin resistance, not getting the substrate in here, the glucose in here to form energy. So unless you're running all these tests, insulin, blood glucose, hemoglobin A1C as a marker, you don't know if the cells are working properly, producing enough ATP. Then there's the urinary organic acid profile that I run that very few doctors do that tell me about many different things. There's numerous tests within it, and a whole section of it tells me about mitochondrial function. If the mitochondria are being poisoned by chemicals, too many free radicals, oxidative stress, inflammation. So that's a very important test I run on all my patients with chronic muscle pain. I've had numerous patients come to me that have been through the gamut with chronic back pain who just couldn't get better, and I found out I had one nurse, she had really severe malabsorption, so she wasn't getting enough nutrients into her mitochondria, enough substrate into her mitochondria. She wasn't getting enough healthy blood fats to build cells to the muscles. There were multiple deficiencies, so we had to help heal her gut so she could absorb properly. There are many different ways that we come to, and her low back pain after many years went away. And I have another 70-year-old gentleman who developed severe upper shoulder neck pain, and I found that he had actually thyroiditis. He had Hashimoto's, and it's an autoimmune disorder. So I had to go after the underlying inflammation, the autoimmune disorder, to fix that. And even at 72, he healed very quickly. And that brings us up to thyroid antibodies. You don't know if you're 90% today of all hypothyroidism is caused by Hashimoto's thyroiditis. 9 out of 10. 1 out of 10 in America has Hashimoto's and don't know, and many don't know it. So you have to measure those thyroid antibodies to know if it's an autoimmune disorder. There's nothing wrong with your thyroid. You have an autoimmune disorder which is attacking your thyroid, making your muscles fatigued and achy. You need to run the test to find out if that's it. So I hope this gives you some idea. This is the complexity at which you need to go after that chronic. I've rarely found an individual come in who just says, yeah, I got low back pain, nothing else. I don't have any digestive issues. I don't have any GERD. I don't have any irritable bowel. I don't have any depression. I don't have any, everything's perfect, but just I have a backache. Usually there's some other underlying issues that we have to look at. Now, when we have this myofascial dysfunction because of this underlying metabolic issues, we form decreased cellular energy, and that causes the formation of neuromyofascial trigger points. Some of you have heard of trigger points, some of you have not. We all enter into this at different levels. Some of you have been searching for answers and have been online and got, or been maybe even trying self-care devices to help treat your trigger points. But this is the key. These trigger points form and send signals. Here's the thing. you maybe call them muscle knots, sore muscles with muscle knots. And these muscle knots or trigger point send pain signals to the brain. They form in muscles, tendons, and ligaments. Muscles are huge, and that make the muscles stiff, sore, and weak. Stiff, sore, and weak. I can't get my back better, can't get my neck better. Multiple trigger points that need to be treated, but you also need to treat the underlying metabolic issues in the muscle. And it's also neurological, because once these fire into the spinal cord, I love neurology as a neurologist here, so bear with me here. As it fires into here, it's actually going to go up levels and go down levels as pain signals, and so it's going to spread. You can have some trigger points in one area, then it begins to spread up. And many have come in saying, I don't know, it started here, and then it started going up into my neck and then down my middle back, or whatever. It does that. These are called the tracts of Lesueur, and it'll spread the pain. Also, it goes up. For you to know that if I stick a pin in your muscle, you don't know it here. The signal goes up to the thalamus. You don't know it here. You don't know it until right here and up in the cortex. So the signal can get ramped up, and this area of actual pain perception can grow. It can spread. And so now we're experiencing more and more pain as it spreads. So this is called neurological CNS windup. The pain spreads. Started out my low back facets, went to my gluteals and to my thigh pain, and I think I have a pinched nerve, but actually we have this myofascial issue going on. And in most patients who have full-blown fibromyalgia, it started in one area and spread from there. So the underlying cause of trigger points and myofascial pain is chronic inflammation, oxidative stress, and you can't knock this out with NSAIDs. NSAIDs will create more health problems over a long period of time. You have to go to the underlying cause of the chronic inflammation. And when that's there, we start seeing multiple trigger points forming in the muscle tissues, in the tendons, decreased energy. We have to go after the underlying cause of these metabolic issues. So, chronic inflammation, oxidative stress leads to, what's oxidative stress? That's free radicals. If you've ever heard of taking antioxidants, that's why vitamin E has been shown to be helpful in muscle pain. If we have oxidative stress in the muscles, we need to take certain antioxidants, and we can test for what type and what kind. That'll form chronic pain-causing trigger points, chronic fatigue in the muscles, even flu-like symptoms, and can be a real problem. So what is causing this underlying metabolic issues? The chronic pain, fatigue, insomnia, anxiety, this is all caused by the chronic inflammation, oxidative stress in myofascial pain syndrome. And it's brought on by maldigestion, malabsorption, like I mentioned with that one nurse, which can lead to nutritional deficiencies and insufficiencies. A huge issue is dysbiosis, leaky gut. Maybe you've heard the term, maybe you haven't. Dysbiosis, leaky gut. So then if we have a leaky gut, that leads to more food allergies because the gut is not tight. We're getting partial proteins leaking through into the bloodstream. There are papers and articles on my website about this. Insulin resistance and metabolic syndrome, we talked about that, the cells not being healthy enough to get in the substrate and nutrients to produce the ATP and the hormonal dysfunction, the thyroid, adrenal, all this leading to mitochondrial dysfunction. So the reason you're not getting better if you have chronic myofascial pain syndrome, chronic low back, chronic headaches, fatigue, is because you're not looking at the fight. I talked about the fight. F-I-G-H-T. We have to look at the food and inflammation and immune system and GI and hormone balance and toxicity issues. Now sometimes there's confounding issues, and I don't want to get too far into this, but we have autoimmune disorders, Hashimoto's, lupus, toxicity issues with chemicals and heavy metals, phthalates and BPA and plasticizers. I mean, our environment is getting more toxic. This can suppress immune function. That can lead to chronic infections. You've heard of Lyme disorders. We have chronic Lyme disease. That's going to lead to issues where we're having a lot of muscle pain and joint pain. And there are many other type of infections, chronic viral infections, mycoplasma. So again, sometimes we drill down deeper and we find this is a source of chronic inflammation. And we should even have something called hypercoagulability states, that when we have a lot of inflammation, the blood thickens. I look at fibrinogen and some other markers. And that means the blood isn't perfusing the muscles very well. We're getting decreased oxygen. The mitochondria don't have enough oxygen to produce ATP. And we've got issues. So again, you have to drill down deeper with functional medicine to see what's going on. And again, the roots of your health is the digestive tract. So if you're having chronic myofascial pain, a source of this can be the GI system. Maybe you have GERD, but just very quickly, in this rough diagram, we have food coming in, we have hydrochloric acid production, mucin protect the stomach, we come in, the bile is dumped, we go through and we have breakdown of proteins. If things are healthy, if we're not maldigesting and malabsorbing. Now, one of the things is that this 21 feet has a coating of bacteria if you're healthy. Good bacteria, 3 to 6 pounds. There are more bacteria in your gut than there are cells in your body. Now, dysbiosis, bad life, Latin, is an imbalance. And in my book, there's a whole chapter on dysbiosis and chronic myofascial pain. And I want you to understand here the issues with that. There is 70% of your immune system lies in your GI tract, and if there's bad things growing here, it's like talking trash to the immune system, like getting it riled up. And the immune system gets riled up, that cytokine production can go global, all over, inflammation. So no matter how many NSAIDs you take, you have this going on, kicking up the inflammation, making your muscles in your back or your neck inflamed, sore, achy, trigger points. So this bacterial imbalance creates immune system activation, systemic inflammation, endotoxemia. Every patient I've seen with chronic myofascial pain has usually had some sort of bacterial imbalance, and many of them have some sort of digestive issues. Digestive issues, you have to look at this bacteria. We have bacteria from the mouth to the anus, and all these bacteria have to be properly balanced, or we have problems with constipation, diarrhea. So this is huge, like the roots of a tree. And if you have more interest in the digestive aspects, you can go to our digestion video and look at that. So what do we do here that's different? If you've got chronic myofascial pain, chronic low back pain, we're going to treat the trigger points. We're going to give you ways to treat the trigger points. I invented the Phoenix Rehab System for people with chronic myofascial pain. It is a product that allows you to treat the myofascial trigger points, not having to go constantly to get massage therapy. It's described in the textbook. The Phoenix Rehab System comes with a self-guided DVD that takes you through it. We train our patients here. There's a bag of different sized digits with a guidebook. And so what it is you're using a portion of your body weight to apply pressure. These are like thumbs that can be placed at different strategic places to go after the trigger points. So as you're deactivating your trigger points, we also have to drill down deep and find out what's going on with your overall health. So we do a comprehensive health history, comprehensive neurological exam. I spent about an hour with you going through a neurological, nutritional, orthopedic exam. Then based on this, I will go after certain specific functional lab tests, comprehensive blood tests, thyroid, an assessment for insulin resistance, metabolic syndrome, mitochondrial function to see if they're doing well through a urinary organic acid profile, comprehensive digestive stool analysis to see if you have good bacterial balance, if you're absorbing, properly digesting, food allergy test to see if food allergies are kicking up your immune system. You have a leaky gut, I find in the digestive stool analysis, and hence you've got more IgG food allergy antibodies. So I don't leave a stone unturned. It's not, there are even more tests than this where I can go after to get at what's really taking place in your myofascial tissues. So if you really want to heal, you have to think outside the box. Think outside the box, run the right test, do the right myofascial care, and get the 3 R's. The 3 R's is to identify and remove anything that's causing harm. Trigger points, heavy metals, chemical toxicity, maldigestion. Restore what's deficient, nutrients, magnesium, B1, very commonly deficient, vitamin E, antioxidants, whatever I find in laboratory testing. Activate, repair. This is big. Once we're doing this, I need to also get your tissues moving in the right direction, and we use different forms of therapy here. Brain therapy is huge because the brain runs the muscles. And there's articles on that on the website and DVDs. But acupuncture, I'm trained in traditional Chinese acupuncture. Use microcurrent, whatever it takes to help you remove, to stimulate repair in your tissues. Then we also have to conquer the pain and stiffness and weakness by removing the trigger points through myofascial release and the metabolic therapy. And how we do that is the myofascial therapies, trigger point therapy. This could be the platform with the thumbs, or a T-bar. I've got to go after these. You have to go after them. Actually do dry needling acupuncture to go after these trigger points to remove them. And we have to make sure the neuromyofascial tissues are healthy, energy rich, plenty of ATP, and then we get that going. That is how we remove this myofascial pain in your low back, neck, shoulders, headaches. Done it thousands of times. People have been all over, unable to get relief. You can't keep just going. I mean, one definition of insanity is keep doing the same thing over and over again, expecting a different result. If the physical therapy of stretching, the spinal adjustments of chiropractic, if the drugs of medicine have not affected a correction of this myofascial pain syndrome you got, then you need to go deeper. You need to dig deeper. So we need the 3 R's. We need to go after that and correct this. Now, if this makes sense to you, if this is like, okay, I've been suffering this now for 6 months, a year, whatever, and it's just not going away, I need to take a different course. I need to do something different. I need to fight back before this becomes worse. I can't live with these headaches. I can't live with this shoulder pain. I can't live with this back pain. Then, and if you're ready to fight for your health, then call. Call at 763-862-7100. Schedule a free consult. Bring in any lab work you have, imaging studies that have been done, and I can answer your questions. If you have a bulging disc, does it need surgery? Can we still fix this? Whatever your question may be, bring in whatever information you have, and you'll get a 10-minute, 15-minute consultation at no charge, because this is different, and you need to have your questions answered. Watch the video again. Make sure you answer all your questions. There are articles online. But we can help you. I can get this pain corrected. So if you have any questions, please call me again at 763-862-7100. And I thank you for taking the time to listen to this 30-minute video. And I hope to see you soon in our clinic. I'm Dr. Greg Forrest, Clinic Director of the Pain and Brain Healing Center, board-certified chiropractic neurologist. And again, thank you.